Welcome back, everyone, and welcome to fall. I can't believe summer is almost over and we are starting fall already. Where does the time go? We've had some exciting events at this center. I hope that you have been in to check them out. The Vets and Friends had a wonderful picnic at Dennisport Memorial Park, as well as a wonderful fishing trip. So a special thank you to Captain Chip Carroll and the Albatross crew for hosting. Make sure that you check out the Vets and Friends for their events coming up in October and September as well. Just a special note that the upper parking lot will be under construction for the month of September. So you're going to have to park in the lower lot when you enter the center. Just make special preparations for that. We're going to try and make accommodations for those who are not able to climb to the upper levels. So please call the center if you have questions on anything in regards to that. Other exciting news, September is National Senior Center Month, so we're going to be celebrating all month long. The supporters celebrated and helped participate in National Night Out, so we hope that you are able to participate in that. Other exciting events that we do have coming up include Book Club, Tea and Talk, Country Line Dance Fest, and the monthly birthday parties. So if you're celebrating a monthly birthday in September or October, make sure that you come into the center on the date that's listed in the newsletter and get a piece of cake and celebrate your special day. We also have an event in September, which is called an open house, and that's going to be with J1 students and their host families. And that's going to give you a special opportunity to meet the students and the families and learn all about the experience and how it went, and maybe you would be interested in doing that and just learning how everything went. As always, Dan is working very hard in transportation, but he is looking for help. So if you know anybody that would like to be a driver, please let us know. Call the center. If you need a ride, also call. And we do have 2 field trips coming up, one to Provincetown and one to the Sandwich Glass Museum. So if you would like to register, again, call. In the fall, we will be focusing a lot on scam prevention. We've been getting a lot of calls that people have been scammed, have about to be scammed, know someone that has been scammed. So if this sounds like you or someone that you know that you are not alone and know that it's okay, and we are aware and we're trying to do everything possible to bring awareness to this issue. So we actually have somebody joining us today that is going to tell their story. It's not a scam that you typically think of in regards to money or gift cards, but a story that I think will be eye-opening and something that you might want to look out for. So we are going to be joined by a woman named Celeste, who is going to tell us her story on how her Medicare was scammed.
Hi, I'm Linda Colby, a member of the Elder Abuse Coalition. We can all do our part to help in this endeavor. You may reach us at the number below. Please call us for any information.
Okay, everybody, welcome back. Today we have a very special guest. We have Celeste joining us. So Celeste is here to tell us a little bit about her story, and I thought it was very important that we highlight what has happened to her and her family, and we wanted to just bring a little bit more awareness to scams that are happening these days. So welcome, Celeste.
Thank you. Thank you for inviting me here.
Of course.
Yes.
So you guys have been living here on the Cape, and you just happened. Let's start from the beginning. So how it all started one day.
Okay, one day. There was one day when the phone rang and I answered it, and it happened to be somebody, there were a couple of men that happened to be on the phone, and one of them said that they were calling from the United States Medicare office, and they were calling about, you know, they asked me if I had a Medicare card, and I said I did. So they said, well, would you go get it? So I did go get it. And they asked me what the numbers were on my Medicare card. And I said, oh, you tell me what they are.
Right.
Because I felt that they had some idea of why they were calling me. So from there, one of them kept talking, and they kind of had a little foreign accent, even though they were calling from the United States Medicare office. I was surprised that they had a slight foreign accent, and there was sometimes when I didn't always understand what they were saying. But anyway, one of them, when they were talking to me, kept saying, if you get another phone call, make sure you don't mention the Medicare card. And I'm thinking, oh, okay, I'm really not too sure what this call is about in my mind. But I decided, you know, I'll just listen to what he has to say and so forth. Then when he asked me to, when I got the numbers for the Medicare card, he asked me to read the numbers, and I said, no, you read them to me.
Right.
Because I felt I was being used in that particular situation.
And so how did he respond when you said, you read them to me?
Well, he did read the numbers that he had on he had, okay, and he was more than willing to read it off to me. He also wanted to know, get the name of my primary care doctor and where they were located. And I just, you know, mentioned the name and so forth. And I didn't think anything of it. It will come later. So frequently in his conversation, he kept saying, if another caller gets on the line, do not mention Medicare card. And if he said it once, he said it 10 or 12 times. And I'm thinking, oh, what's this with the Medicare card? And a short while after that, he said, no, he said, in the conversations we've been having, he said, is there anything that you would mention, a key word that would keep you from remembering something? And I said, oh, I happen to think quiet, Q-U-I-E-T. And in the quiet, I was trying to get away from the fact that I knew what he was trying to do, so I was going to have my own strategy as well. And later on in the conversation, he said, oh, by the way, he said, what was that word that you came up with that you thought we both would be familiar with? So I said, oh, quiet, Q-U-I-E-T, amen, goodbye, and I hung up the phone. So that was taken care of that way. Then I had, and this started around May, the year 52, and I have a note here of like May 26th. A female caller from Medicare called to speak to Celeste. And that was a hint, that was our hint, because you don't pronounce my first name, Celeste, it is Celeste. And then I got another spam call, and it was from my primary care doctor, but it happened to be a female calling from my primary care office, and they didn't have much information for me. And then after a while, we started to get the scam calls, which would say scam on the phone, and it would be from anywhere from South Dennis to other parts of the United States, like any of the connecting states to Massachusetts. these calls would come in. And about this time, my summary sheet from Medicare came in, and we happened to be looking at it. My husband turns the paper over, and on it, it said, on the back side, it said, there was a column there, and it was marked, how to report fraud. And we got right on the phone right then and there and spoke to 2 different women from Medicare and from the billing women who do this. They check into a fraud, and the first woman asked us different questions about what we had experienced at that point, and then she transferred us to a second woman who did the same thing. And it just
so at this
and then they had discovered a charge on my Medicare card that was a little bit high, and so they questioned that.
So that wasn't your charge?
No.
So at this point, they knew, the real Medicare people knew that something was going on. So the pieces are starting to come together, that you're getting these calls. Now you're starting to get these abnormal charges on your Medicare summary.
Right,
okay.
Right.
And you know, you might be listening to this story, and it's a different type of scam almost, because it's not somebody calling up and saying, hey, could you wire me some money or gift cards or something like this. This is quite advanced in the sense of, you know, you're thinking, why were they Medicare, your doctors? There's so much out there that it's so easy to fall into, because a red flag would go up maybe if they wanted some cash or something,
mm-hmm.
but these people are going after your Medicare.
Mm-hmm. Mm-hmm. Right.
So now you're on the
right.
phone with the women, and
right.
there's a phone number on your Medicare statement that we can link. So if this, you know, you think this could have happened to you, you can call the number. So now you're talking to the women on the phone, and what happens?
Actually, we didn't have that much of a conversation.
Okay.
Oh, we went through all the details
right.
with them, and they said that they would look into it right away, and they would get back to us and let us know what findings they had through their research, because they were able to trace phone calls and so forth.
Right.
So it did take a little while, but they did send us a report with what they had found, and that they had found that you know, everything was working along and being stopped and so forth. So in the meantime, I realized that one of the men had asked me in the original phone conversation, he asked me if I had any medical problems, and I said, no, not really. And he said, well, is there anything that really bothers you? And I said, well, I fractured my ankle, I fractured both sides of my ankle a while ago, and I said, it does hurt. So he said, well, do you need anything for that? And I said, no, I don't think so. I think I can, you know, work it out and walk it out. And so he said, well, what about knee braces? And I said, well, I don't know how that would help. But anyway, he kept talking about the knee braces, the knee braces, the knee braces. So then we ended up, as part of this process, we were getting calls from Florida, from a company. It did have the name of a company, and they said, we haven't got our stock yet, but as soon as our stock comes in, we'll be able to send the supplies to you. And I'm thinking, oh, don't tell me this is the knee braces. I said, I don't even need the knee braces. Well, it wasn't too long when we had gone out one day, and when we came home, there was a sign on our front door, and it was from UPS, and it was saying that they had tried to deliver a package, and we were not there, and so they put it back to the warehouse, and they would probably bring it the next day. So the next day we happened to be home, and there was a UPS truck in front of the house after a while in the afternoon. And so this young man comes to the house, and we answered the door, and he had a package in his hand, and my husband said, "Oh," he said, "what is that?" And he said, "Oh," he said, I don't know what it is." And my husband said, "Well, where did it come from?" And he said, "I don't know. I don't have anything on here that says where it came from." So my husband said, "Oh, okay." He said, "Well, we haven't ordered anything." And because now the young man handed us the paper to sign. And my husband said, "Oh, he said, we're not going to sign this because we haven't ordered anything and this isn't our responsibility." So we didn't sign that. So even after a while, we would get calls from the company that manufactured the knee braces, and saying, "Oh, we're so excited because we've got our stock back in and we're ready to send it out to you, so give us a call and let us know what your number is," and so forth. Well, I never bothered to answer that call. And in the meantime, we started getting calls from all over the place, and I'm thinking, what the heck is going on? And it would say like scam, and then it would have a number on it. But I always checked I was able to check the phone numbers with my phone after the call, and after I had a button on our phone that said either phone book or it said caller list. And I always hit the caller list because that would tell me who the caller was.
Right.
Sometimes it would give a name, other times it would give a phone number. So I was able to make a list of phone numbers, and I ended up with quite a long list of phone numbers.
You almost feel like you're under attack
Right.
at this point. Every
Right.
time the phone rings, you're wondering who it is.
Yeah, it was surprising to get one from Orleans and get one from local areas too, because I'm thinking, why are these people calling me? But I got to the point where I could ignore it.
Right.
Oh, and when the calls continued to come in, in August, we had called the fraud department, and they let us know that they were investigating all these calls in order to eliminate the phone calls, which helped a lot. One of the things that I felt, from my point of view, was I felt that if I was at the dentist's office and I mentioned something about, "Oh, you wouldn't believe I'm getting these scam calls," and they always turned to me and said, "Oh, well, Medicare doesn't make calls."
Right. I was thinking when you were talking, think about how hard it is to even get a hold of your primary care or to even get a hold of Medicare. In today's day and age, right, they're not calling anybody. They don't even think they have the resources to do so. So that's something to look out for. If you notice that Medicare or your primary care or people that are identifying as these people start calling you all the time, logically they're not. When you call them for a problem, you can't even talk to anybody for 2 days,
Right. Right.
And another thing I picked up on was during those phone calls, they fish for information. So what you're unknowingly telling them about your ankle or your leg, and they build on the information that you give them,
Right.
and that's how they commit the fraud.
Right.
Is you don't even know that you are telling them these things.
Right, right. And also signing the paper that
get your signature.
To get the signature is also giving them more power, because they can use that signature
And that
for
was
anything.
very smart, because I would probably have signed it and not thought anything of it, but they would have gotten a copy of your signature, and then it would have really gotten possibly worse.
Right. So in my experience, I would definitely, I definitely feel that any medical area, because for me, I was a teacher, and I didn't have a lot of exposure to the medical field and so forth. I didn't work for a doctor. I didn't work in a doctor's office or anything like that. I wasn't in the hospital every other day. So I really knew nothing about the procedure of Medicare. But I would definitely think, you know, different times when I did go to the senior center, I'm looking for the sign that says Medicare does not make phone calls, and I never saw it. And I definitely feel that when you involve people in an age that's beyond being in a doctor's office or whatever, not necessarily as a patient, but just, you know, being there, I do feel that that's an important thing to have, is in a senior center or in an area, you know, where you have people that are not out working and so forth, but it gives them a message, oh, but Medicare chooses to use the written word if they want to contact you. They don't choose calling you on the phone. And this was kind of a surprise to me. The other thing that I realized, and it took 2 or 3 weeks after this thing started, after these phone calls started coming in and so forth. And yes, I did get calls from my doctor's office, but it was some woman that was on the call, and they didn't identify who they were and where they were coming from and so forth. So those calls were, you know, we just hung up on those calls. But I would highly recommend that it be put out there that Medicare does not make phone calls. They mail a lot of the information out. So they use the written word in order to pass information on. And the other thing that I realized after a while was, in the course of going through the different calls coming in and what have you, and not only that, but the initial 2 callers that called and kept, I heard them when they said, if someone else calls you, do not mention the Medicare card. And I knew the Medicare card had something to do in this whole process. So I definitely avoided the Medicare card.
Right.
And that's why I chose a different word of quiet. Being quiet, don't mention the word.
Right.
Be quiet about it. But I realized after the fact that what I could have done was I could have quietly taken the phone away from my ear and hung it up and walked away. That's what I kind of kicked myself about. And even yesterday we were going over some of my notes and so forth, and before we finished, and I ended up with like 1.5 pages of notes, before my husband and I finished with, and we're happy with what we had, how we had set it up and so forth, we did get 2 phone calls from my primary care's, on my primary care's phone number, and that's in Massachusetts, and we never answered it.
Yeah, you have to be on guard now.
And that's it. We have to be on guard.
But I think what, you are trying to kind of say is, you wish that you hung up the phone, but what you're doing is good, though, is because you're trying to now tell other people your story and what to look out for, and that it's okay, because I think this is happening to a lot of people, and they're very embarrassed or ashamed, and how could this happen to me, and how did I not recognize it? And it's okay, it's happening to almost everybody, and it's only getting more advanced, more and more as the days go by. How they're doing these scams is only getting crazier than you could ever imagine. So you're very courageous for just coming on and telling your story, and how you were able to get past it, and that you're still getting calls, but it's okay, you're getting through it. So we thank you very much for coming on and telling us. And yes, if you think Medicare's calling you, it probably is too good to be true.
Right.
Because they're not.
They're not.
They're not calling.
They're not calling. And one of the things that I wanted to mention too was on when you get your Medicare notice, usually like every month they send out a notice on Medicare, and it says there's a paragraph there that says how to report fraud. So if you have anything dealing with Medicare, make sure you look at that and call, and they're more than willing to help you out.
Yes, we're going to put that number up for everybody, and if they have any questions or think something may be off, call that number and definitely report it.
But I have to say, I have learned my lesson, and I am not very careful.
Good.
So
good. It was an unfortunate situation, but hopefully you avoided anything catastrophic.
Right.
All right.
Right.
Well, thank you very much, Celeste.
Well, you're welcome.
All right.
It was nice to be here.
The Cahoon Museum of American Art is a unique Cape Cod art museum located in Cotuit, Massachusetts. The Cahoon Museum welcomes visitors of all ages to learn about art and history and to enjoy fun, family-friendly events throughout the year. We offer artist talks, lectures, open houses, art demonstrations, parties, workshops, plein air painting classes, and more. With changing art exhibitions, both inside and outdoors, featuring local and regional artists, there is always something new and exciting to see. You don't need to travel to Boston with such an outstanding art museum right here on Cape Cod. Take a break from life or make a date with a friend to stop in and find unexpected inspiration and the joy of art. The Cahoon Museum also has one of the best gift shops on Cape Cod, featuring jewelry, art books, pottery, and gifts made by local artists. Visit our website, cahoonmuseum.org, to find out more. The Cahoon Museum is not to be missed for local arts and culture. Located at 4676 Falmouth Road, also known as Route 28, I hope to see you soon at the Cahoon.
Very profound interview with Celeste. Again, not the typical scam you would think of, but they're out there, and you know, when in doubt, whenever you think something's off, it probably is. So just be vigilant, be aware, and don't be ashamed. It's happening to a lot of people. So just keep your guard up and call the center. You know, keep us informed. We're really trying to bring awareness to this issue. But moving forward, we do have a new exciting program, and that's going to be called Destination Respite. So we are calling all caregivers out there to take advantage of this program that we were awarded a new grant for. So there's going to be several local agencies working together on this program to provide more respite options. So that's going to be the Barnstable Adult Community Center, the Alzheimer's Family Support, and the Yarmouth Senior Center working with us here at DeKalb to provide respite care, to give caregivers some time off to do things that they may need. So that's very exciting because respite is very hard to find, especially on the Cape, and we're going to have those agencies working together. So that's very exciting. There will be a big feature on that. And again, call the center if you have questions. We also still have Pearls as a resource if you're feeling overwhelmed or having any mental health struggles. We do have the mobile food pantry that assists with groceries. Julie will be taking that over as the new head of outreach. Fuel assistance time is approaching, so if you are somebody who feels that you used fuel assistance in the past or you may need it, again, Julie is the person to contact. So along with fuel assistant, outreach does need volunteers. We are restarting our friendly visitor and reassurance caller program. We've learned that isolation is one of the things that older adults struggle with the most. Open enrollment for Shine will be approaching. So we think that we have the perfect person to join us, the Shine program manager for Barnstable County, Christina, and she's going to tell us about all things Shine and Medicare and open enrollment. So we have Christina coming up after the break.
Everyone knows, in an emergency, you call 911. And do you remember calling 411 for information? But what do you know about 211? If you need help feeding your family and don't know where to turn, you should call 211. If you're a veteran looking for specialized services in your area, you should call 211. If you're unemployed or underemployed and don't know how to find the best opportunities for you, you should call 211. 211 is a free and confidential service that helps people across North America find the local resources that they need. No matter the time or day you find yourself needing help, a trained professional is ready to connect you to the community services around your area. Call 211 or visit 211.org and let us help find you the resources that are right for you. And if you represent a local nonprofit, civic organization, support or advocacy group, or other service agency, you should know if you are signed up with this important and free service. Registering with 211 helps locals connect with your health and human services organization. Whether you help victims of domestic abuse or provide housing assistance, work in addiction services, or run a support group, make sure that your organization is partnering with 211. Contact mass211.org for more information.
Okay, everybody, today we have a very special guest, Christina. She is the Shine Program Manager for Barnstable County. Welcome, Christina.
Thank you so much, Kelly. I'm delighted to be here.
Yes. So first I want to start off by, what is Shine, if people don't have any knowledge of what is Shine?
Yes, so Shine is a statewide program here in Massachusetts, and Shine stands for Serving the Health Insurance Needs of Everyone. And the goal of Shine is to really provide unbiased, free insurance information for those folks who are turning 65 or who are 65 and either need or currently are on Medicare.
Awesome. So that's obviously very important, especially with the older population and open enrollment time coming up. So first I want to start off, we've seen a lot in the field that I work in regarding scams. So I just wanted to touch base with you because you're, while I have you here, the perfect person to ask. What is something that people can look out for, that, like, information that would never come from Medicare? That where they could really, people could really identify as being a scam, number one.
Yeah, we've seen since the pandemic scams going up. I think I saw a statistic about 400%. So it's definitely an issue and definitely a problem for older folks and vulnerable populations. So, you know, Medicare is never going to call you on the phone. Medicare is not going to send you a text message. So if you receive a phone call from Medicare or a text message, people asking for your personal health information, identifying information, never give out your Medicare number. You know, never give out your date of birth, never give out your Social Security number. For me and my family, we actually have something set up with my mom that if she ever gets a phone call or a piece of mail or a text message, she needs to take a picture of it or forward it to myself or my brother. That's just an added kind of way to protect her interests.
Right.
You know, there are stories out there of people losing even hundreds of thousands of dollars and life savings, and it's incredibly tragic and it's scary for folks.
Absolutely, and I think, you know, that is a great thing that you've done with your own mom, is just show me, you know, because it is, and it's evolving, it's becoming so high tech with the voices and the calls and the texts, and they're persistent. So just know Medicare is probably not going to call you or text you, or just think of how difficult it can be to get in touch with them. So
and we have in Massachusetts, there's something called the Senior Medicare Patrol, and they're an organization that will investigate if you think you might have been scammed, or
Okay.
even if you have a question, because, you know, we all are kind of wondering if someone
Right.
wants my information, I don't want to lose my health insurance. So they're a good resource to contact. So the Senior Medicare Patrol is there for folks if they run into any trouble or if they have any questions.
Yeah, so you mentioned that you did tell your mom to send you that information. So it sounds like you have a background, you know, of knowledge to tell your mom that. So how did you get started with all of this? So tell us a little bit about yourself. How did you get where you are today?
Great. Well, thank you for
Yes.
asking. So I'm a licensed independent clinical social worker. I've been a social worker for over 30 years. I actually have both a bachelor's degree and a master's degree in social work. I'm one of those probably rare but very lucky people who knew early on what I wanted to do. And, you know, I really wanted to be involved in a profession that allowed me to interact with people, to engage people, and to help people. So over 30 years, I've done a lot of different types of things. I've done individual clinical work as well as more macro program management, organizing, administrative work. I've worked in child welfare, in state government, also working for the National Association of Social Workers here in Massachusetts, and then spent a good amount of time at Boston University School of Social Work. I still teach for BU online in their MSW program, ethics and policy courses. So throughout my career, you know, I've gone from that kind of individual to that more kind of macro policy level of interest and developed a real interest in health equity.
Absolutely.
So for the past couple years before coming to Shine, I was involved in a democracy organization, getting individuals to register to vote, using trusted messengers like social workers, doctors, nurses, to help folks use their voice and vote, because
That's awesome.
so many of what happens in the medical room with a doctor is determined by the policies and the elected officials that are creating those policies. So after doing that work for a period of time, and I'm still very interested in making sure people are, you know, registering to vote, I was looking around. You know, the pandemic was a difficult time for a lot of people. I had been working remote for a long time and wanted to get back into being engaged in my local community, working with individuals. And when I saw serving the health insurance needs of everyone, that just resonated with me, given my
Absolutely.
experience as a social worker and my focus and real interest in health equity. And it's been great. This position is wonderful because it allows me to work with folks individually, doing counseling, talking to individuals about their own health insurance needs, as well as coming out into the community. I get to travel across the Cape and the islands and meet with councils on aging, senior centers, other local community organizations to talk about what's available for folks once they turn 65, or for folks who are disabled and under 65, because Medicare is also available to some of those folks too.
Absolutely, because the entire, you know, process of Medicare can just completely overwhelm people, you know, so it's nice to just help on a bigger scale, but then on a smaller scale itself where, you know, it's going to be okay, we're going to get through this, we're going to help you with any questions you have, we're going to help you enroll, and that's really the goal of Shine, is to get individuals the service that they need, right?
Yeah, you know, there's so much information out there that's very confusing, and Medicare is kind of a web. And, you know, we talk to people all the time who say, you know, I'm a fairly intelligent person and I don't understand this.
Right.
Or they see a commercial on TV with Joe Namath. I actually saw one with Big Papi the other day. And they're like, oh, I want that, what they're selling.
Right.
And that may not be the best plan for you, or it may, you know, it may include a network of doctors that aren't here on Cape Cod. You know, once you cross that bridge, it's different on Cape Cod, and there isn't as much access to medical care as there is.
My grandmother experienced the same thing, where she saw a commercial on the nightly news, and she was so excited, and then she got a piece of mail, and she was thinking this was the next best thing to add to her Medicare, and she was going to get dental and vision coverage, and life was going to be complete. In the process of filling out the paper, and I luckily got it and I read it, and when I did, I realized it was going to cancel out her Medicare.
Yes.
So by signing the paperwork, it wasn't adding anything to it. It was getting rid of it.
Yeah.
But because she had saw it on the night, on the TV, and got the mail, she thought it was real. It was going to give her. So I think having some people out there in the community can help maybe point in the direction that maybe that's not the route you want to go, or this is what that is, and all the different parts. It's confusing.
Yes, and we're very lucky here on Cape Cod. We have about 73 certified SHINE counselors across the Cape. Most of them are located at our councils on aging, as well as some community-based organizations. So these are your neighbors. These are other folks who live in your town, who volunteer their time. And I will say it's not easy to become a SHINE counselor. You have to go through 40 hours of training. You have to take a test, which is open book, thank goodness. But it's an 80-question test. And then you have to be recertified every year. So these are folks who are very committed. They volunteer their time to do the training, to take the test, to continue to keep up their knowledge, as well as meeting with individuals. And most appointments take about an hour to go through the information. We couldn't do this without the volunteers that we have. So we're always looking for new volunteers, but we're very grateful for the volunteers that we have, and again, couldn't do it without our 73 certified volunteers across the Cape and the islands.
And then what you do is you partner with different agencies and get the volunteers into the agencies.
Yeah, so most of the councils on aging actually have volunteers there. So if you are about to turn 65, or if you currently have Medicare, you can always call your local senior center or council on aging and see if there's a SHINE counselor available or an appointment open, and go, because if there's a window of time right before you turn 65, you have a 7-month period. So it's 3 months before your birthday, it's the birthday month, and it's 3 months after your birthday. So that's when you have to sign up for Medicare. If you're already collecting Social Security, that happens automatically. But most folks, when they turn 65, might still be working. And if you are working, you can keep your employer group health insurance if you work for an employer. See, it's already getting, the web's starting to weave, right? But if you work for a large employer over 20, you can keep that employer health insurance. Otherwise, you might want to sign up for Medicare. And there's parts A, B, C, D, but our licensed or our certified counselors get into all of those details to make sure that you have the coverage that is going to match your budget, as well as meet your medical needs.
Right, what's best for them. And I think that's what you were speaking to with the training of the individuals. And it's good that they're in the community. They might know what you need. So if somebody's watching and they're thinking, oh my goodness, I might have some questions, you suggest that they call up their local center and just see what's available to them.
Yes, and they can also call the county office. Barnstable County actually administers the SHINE program for Cape Cod and the islands. And myself and my colleague, Bill Redman, who is wonderful, he's our project specialist, work for the county. Our phone number is 508-375-6762. You can also call the county, and we can either meet with you in Barnstable Village, where our office is located, or direct you to your local senior center. Because depending on where you are on the Cape, Barnstable may not be convenient for you to get to, so we can plug you into your own local area.
Yeah, and when I was talking to you earlier, you mentioned something about how when you guys, the volunteers are training, you guys almost do like a role playing. You work on difficult cases. So if you're sitting at home and you may be watching this thinking, you know, maybe I dropped the ball, or I've gotten myself into a real big mess, or I might not want to call. That's okay. You know, you guys work and you practice and you try and figure out cases that may be difficult, or
Yeah, we have, again, our counselors are very experienced. I started in my position about 4 or 5 months ago, so I don't have that depth and breadth of knowledge that some of our folks have. So we use one another for consultation. We also have the state office, because the state of Massachusetts and the federal government fund the SHINE program, as well as other community programs and grants. But as part of our training and certification process, our counselors that have been doing it for a while mentor the newer counselors. So we actually just graduated a new class of 15 newly. So I was actually one of those graduates.
Well, congratulations.
Thank you.
You've accomplished so much in your career, and you're still blossoming.
Well, there's so much to learn still, and you know, I think it's our own personal experiences sometimes draw us in, and you know, I think dealing with my own health insurance, the insurance for my parents, making sure everybody gets their needs. You know, you want to be able to help other people, because when you're sick, or you know, if you have a chronic illness or a new really scary diagnosis, you don't want to have to worry about, am I going to be able to afford my groceries this week, or am I going to be able to afford my rent? You know, we're all experiencing inflation. We're all experiencing kind of what's going on in our times. And so, you know, we don't want to get any surprise medical bills. We want to make sure that we're able to get the medication we need. You know, one of the things that I've seen is, you know, folks, when they retire, they've budgeted and they have planned out what their monthly income's going to be. But maybe they haven't been feeling well, they go to the doctors and they get a new diagnosis, and they have a medication that they didn't plan for. And the copay of the medication may be, you know, those medications you see on TV, you know, everybody, they look like they're really helpful, but they can be very expensive. So sometimes that may not be in your budget. So SHINE counts, to get to your point earlier, you know, if you have medications and you're paying a lot for your medications, open enrollment is actually the perfect time, which is between October 15th and December 9th, to meet with a SHINE counselor, because what we do is we can sit with you, you bring your medication list, we can go into Medicare.gov and plug in your medicines and see if you have the best plan that's going to be the most cost effective for you. So this is now the perfect time for those individuals who currently have Medicare to get your Medicare card out, to write up your drug list and make an appointment for open enrollment, because that way we can make sure that you've got the best coverage and most cost-effective coverage possible.
Right, so even if you're sitting at home and you're thinking, well, you know, I'm way past 65, or I got this all figured out, it might be wise to just do what you're saying, to do a review, to make sure that, you know, you're still falling in the best plans possible, the best brackets, because things are changing all the time. So just might having a little check-in is wise.
Yes, those premiums change every year. So it is very important to double check and make sure that your coverage is meeting your pocketbook and your checkbook. So it is very important.
Awesome. That's a good tip, because I would have thought, you know, well, you know, you're enrolled, you're good to go, don't worry. If it's working, don't mess with anything. But I think that's a great thing to know, to stay on top of it and review everything as best as possible.
Yes, absolutely.
Awesome. So open enrollment's coming up. What else do we have? Does SHINE have what is going on in your worlds that we need to know?
Yeah, so we're preparing for open enrollment. But one of the other things we're doing, and that is when we double check your drug lists and Part D plan, and making sure that, you know, you have the right drug coverage. The other thing that's coming up is that during that period of open enrollment, we don't want to lose anybody who's turning 65. So many of the councils on aging and senior centers are going to be holding Shine birthday parties. So if you're turning 65 between September and December, we're going to have an event at the local councils on aging and senior centers where you can come and hear like a Medicare 101 presentation. So myself and other volunteers and staff will be traveling around the Cape. So keep an eye out for your local COA newsletters, or just call your council on aging to see if there's a Shine birthday party coming up. There may be cake, there may be cupcakes, we don't know. I'm not going to wear a party hat or anything, but we want to make sure that people still know the good information up front when they turn 65, so they can, you know, have that information. So we're going to do these presentations to capture those folks, because during open enrollment we're very busy, and we're trying to get as many people in as possible.
Absolutely, and just some frequently asked questions, I'm assuming, you know what I mean? I feel as a lot of people probably are wondering the same questions, but they're probably a little too nervous to ask because they might think, oh, that's a stupid question, I don't want to ask. But this is a perfect opportunity. The Shine, you know, birthday party's coming up, you know? So that's exciting. So I had a question, and I know it's probably a silly question, but I sometimes still get confused on the difference between Medicare and Medicaid. So if you could just break it down a little bit, I think it could help a little.
Yes. Well, let me tell you, Kelly, a lot of folks get confused between Medicare and Medicaid, and sometimes I even need to use my little cheat sheets to understand myself.
Okay,
so you're in good company, yes. So Medicaid, both are federal programs, but Medicaid is what comes to the states, and that is for individuals, and in Massachusetts it's also called Mass Health. So those are individuals who meet a certain level of the federal poverty standard. Those can be folks who are 65 and under or 65 and older. Medicare is only for folks who are 65 and older. However, some folks, when you're on Medicare, can be dually eligible for Mass Health, which is Medicaid, as well as Medicare, based on your income and your assets. So as Shine counselors, if you come to meet with a Shine counselor and you're turning 65 or you're already 65, we will screen you for your eligibility for Mass Health to see if you might be dual eligible. You could qualify for Mass Health. You could also qualify if your income's a little higher or your assets are higher for what we call buy-in programs. So it's very confusing. But when you think about Mass Health, kids can be on Mass Health, families can be on Mass Health. And one of the things that's been going on now, it started in April and it's going to be going until April of 2024, is what they're calling the Medicaid unwinding. And that means that during the public health emergency for the past 3 years during the pandemic, folks were allowed to stay on their Mass Health if they had it. So if they turned 65 and were on Mass Health during the pandemic, you stayed on Mass Health. So what's happening now is the public health emergency is over, so Mass Health is catching up with all of that. And they're sending out blue envelopes. So if you receive a blue envelope in the mail, don't put it aside, open it right away. Because you have, I think it's about 90 days to complete the information to see if you still qualify for Mass Health. So we're starting to get a lot of calls right now of folks saying, I just lost my Mass Health, I'm over 65, what do I do? The good news is it opens up a special enrollment period window so you can apply for Medicare. And if you don't qualify for Mass Health kind of as it is, there may be another buy-in program that can pay for your premiums and even some of your co-pays. So again, it's complicated information. It can be really off-putting for some people, but the important news is that the Shine counselors are there
Can help.
to help you.
Right.
Even if you don't receive a blue envelope in the mail, anytime you go for a Shine appointment, if you're turning 65, we screen you for any state programs that might kind of supplement the Medicare. And again, that's by paying for premiums or any other kind of co-pays or co-insurance. So
you can point the individual in the direction of where they might, need to go.
Yeah.
So it's always just important to call, make a Shine appointment, and if Shine might not be the need or Medicare, there will be resources out there that the Shine representative can definitely help direct the individual for.
Yes, and I want to be clear, if you received a blue envelope and you're under 65 or you have children, you should contact the Cape Cod Community Action Program because they can work with that population. But if you're over 65 and received a blue envelope, you want to call Shine.
Okay, well, that's some great information. I'm very happy that you came to join us. And overall, is there anything else that you'd like to tell us about Shine? Any impactful stories or anything that you'd like the public to know that keeps you going or moving forward?
Well, every day is different.
Yes.
Some days I'm able to meet with folks or talk to folks over the phone. And that's when you feel like you're really making a difference and touching lives, which is, kind of why we get into this work.
Yes, absolutely.
And then, as I've traveled around the Cape, it's been so interesting to learn about the different individual communities and then to understand the needs of individuals as they're living here on Cape Cod and the islands. And then to think about some of the policy issues and the things that, are the decisions that are being made, kind of going back to my health equity and voting rights work and how important it is for folks to be engaged. So going to, their senior centers, going to the yoga classes or even saying, you know what, I think I might want to volunteer because, I want to get out a little bit more, feeling kind of isolated. And even though Medicare, as we said, is kind of a web, it's a great group of people who really care about one another, who care about their communities, and really kind of get into this stuff. So we're really open to volunteers and want to welcome anybody who might have an interest in volunteering for Shine. We need counselors all over Cape Cod and the islands. And
we can link that information if how people can find out more about.
Oh, great.
Yes, absolutely.
Yeah. So, no, I mean, it's a very rewarding program. And again, I just also want to stress our volunteers are amazing and we couldn't do it without them. So we're really grateful for everyone who's come forward.
Yes, thank you to the volunteers.
Yeah, and grateful for folks like you, Kelly, for inviting us out to spread the word. This is a program that is nationwide, and I don't think a lot of people, I didn't know about it until a year ago. So hopefully some new folks are hearing about it for the first time, and if it's appropriate, taking advantage of our services, because we're here to help and we really want to help folks save some money and get the care and the coverage that they need.
Yes, well, we will see everybody at the birthday party at their COA. And thank you very much, Christina, for joining us and all of your wonderful knowledge and help that you're providing for the community.
Oh, great. Thank you so much.
You're welcome.
Hi, this is Mary Taylor, Executive Director at Chatham Marconi Maritime Center. The Chatham Marconi Maritime Center celebrates the rich history of maritime radio and explores the innovative advances in science and technology through the Marconi RCA Wireless Museum and the Education Center. Marconi RCA Wireless Museum is the former Marconi RCA Wireless Receiving Station, once the busiest ship-to-shore station in the United States and a significant military installation during World War II. The old operations building now houses the Marconi RCA Wireless Museum, which offers exhibits tracing the story of maritime wireless communication in Chatham from its formative days with Marconi through the 20th century. For more information about visiting and to learn about Cape Cod's importance on ship-to-shore communications, please visit chathammarconi.org.
All right. Well, thank you for joining us. As always, call the center for more information or questions that you may have. Thank you to our volunteers, supporters, and friends who make everything possible. We will see you soon.